Prolapse cord, a time-critical emergency. So the cord is out of the vaginal canal before the baby is. This is extremely bad news because inevitably the child's head will now compress the cord against mom's vaginal wall or what have you, thereby compressing its own source of oxygen and nutrients and its only source of those things. Not dissimilar to a chokehold on an adult. What are you going to do about it? Call medical control immediately. We almost never see this. Get an actual expert on the line. You're going to begin a very unfun game called How Do We Get Oxygen to This Baby's Brain Right Now? The traditional answer would be via the umbilical cord, but as discussed, that is under siege. We're going to need to explore some other options. Lift up the blanket, take a look. Can you see the baby? If mom is already crowning, encourage her to do another really good push. See if she can't get that baby out before there's irreversible brain damage. And then after the baby is out of the birth canal, it can just breathe through its mouth like you do. That's not very likely though. So let's take a look at this cord. How does it look and how does it feel? It should be a kind of gross, deep purpley red blue color. It also should have a palpable pulse. If it has both of those things, the only bolus your patient needs is a diesel bolus. Get her to the hospital. Your assessment is over, while the baby can still breathe. What you're going to do, you're going to put pads or rags in the patient's underwear. You're going to kind of cradle that cord up against her groin. You're going to do whatever gets her to the rig fastest. It may well be to have her walk. In this situation, a stair chair is actually more likely to cause her to inadvertently compress the cord. This is also why you need to tuck that cord into some underwear with some rags. You don't want it getting stuck between her thighs. Remember, this is essentially the baby's carotid artery. This is all there is. You must protect it. You can put her in this position. This takes some of the pressure off of a prolapse cord, knee chest. So chest is all the way down and then hips are all the way up. Or exaggerated Sims position. That's how these are both equally effective according to data. You have mom, of course, on her left side, hips a little raised, padded between the knees. Either one is fine, whatever you got to do. And then you need to tell the incoming facility about this event. They need to have somebody at the door waiting to meet you so you can hand off this incident for the best outcome. Set up our in-hospital colleagues for success. I have a tocolysis of labor protocol. You may or may not. This would be an exceptional reason to use it, because if the cord is perfusing and you stop the labor, the baby's head will not in fact get a chance to choke itself out. Reassess the cord frequently. This is like the carotid pulse in a ROSC patient. You're going to have somebody essentially assigned to checking it constantly. Don't have them always compressing it, otherwise they're pinching the cord shut. That's not going to help either. Reassess the cord a lot though. Make sure it still has a pulse. If the cord is perfusing, a review. Cradle it against her groin, walk her to the ambulance, talk to your patient about what's happening and why you're doing all of this. Knee chest or exaggerated Sims position, and diesel bolus. Pre-alert the facility and go as fast as possible. Keep checking that cord. Now, your day has just gotten worse. The cord is either not perfusing or it has stopped perfusing. How do we know? It'll be white, and it will have no palpable pulse. This is very bad times. Again, this is the baby's carotid artery. This is everything the baby has. Ergo, if it is not perfusing, baby's brain is not getting any oxygen. What are you going to do? You're going to put mom in a knee chest position. You're going to insert your left hand into the vagina and lift the baby's head off the cord until the pulsations are felt. If the cord is exposed, you can cover it in damp gauze to prevent it from drying out, and don't mess with anything else. Knee chest position, as a reminder, that's good either way. So here's this little maneuver. You're going to physically put your hand inside the patient's vagina, and you are going to hoist that baby's head off of that cord to try to buy yourself some time. How could you possibly do that? With the full knowledge that you are the last chance that this child has to survive without a brain injury. It's just you. You are the end of the line. This is the final moment. With or without medical control approval, depends on your area. My area, we don't need approval. You need a lot of consent from your patient, and you need to tell her this is going to hurt. What if you hurt the baby? Nothing's gonna hurt the baby more than a hypoxic brain injury. It doesn't matter. The baby's life is in mortal peril. It is in imminent danger. Do whatever you think might be best. If you don't do anything right now, you are choosing a fatal outcome. At least try. Can you make this situation any worse? Is there any worse than a dead baby? I would argue no. Fetal mortality in this situation is 91%. So the Grim Reaper has really weighted the dice here, so you need to forgive yourself if this doesn't go right, but also feel empowered to do literally anything you think might help. So there's no pulse after you tried to manipulate it, and it's still white. Okay, that's not great. What are we going to do? You're going to, and then you're going to try again. A provider with smaller hands, a stronger provider, a different provider, to change something and try again. If she's in knee chest position, maybe try exaggerated Sims position or vice versa. I don't care. Change something. Still no pulse? Keep changing things. Keep trying. You are the final defense here. There is no backup plan. You're it. We're at the backup plan. Now, if you get the pulses back, as always, alert your receiving facility about the situation you are about to bring into them so that they can get their very best people ready to receive you. Also, if it works, you are in that position. You are chilling there, holding that baby's head off of the umbilical cord until she hits the OR. No movement, so try to make that person comfortable best you can. Padding, pillows, support, whatever they need to hold that position for this extremely miserable ride to the ambulance, ER, and then surgical ward. Thanks for listening, and remember, I'm not your medical director.